Good afternoon, everyone. I welcome all of you in this lecture series, and today we will have the first lecture, and it is very relevant lecture for all of you. This is related to awareness about quality management system. And now, new edition of this ISO 15189 has already been released, and we have started program based on this new standard yesterday. There are certain terminologies which shall be clear to all of you. We will discuss those things, and certain other important aspects related to quality. Those also will be discussed, and all of you have the calendar of whole year. Every month we will have one lecture based on some relevant topic, and from April onwards, we will start another series. In this series, you will get 12 lectures. From April onwards, we will start another series of 12 more lectures. And people who, I'm telling you this for your information. Suppose somebody joining in the March, and that person missed their first two lectures, January lecture and February lecture, then they can attend the same lecture next year in the January and February. Because I always feel interactive lectures where you can ask your query, those are more important rather than just having a recording. So today, now I am starting this quality management system. First, we will discuss certain case studies. Then you will get the idea how this quality management system is important for us. Although many of you are working in the accredited laboratory, but still this information is useful. Now, look at this scenario. 35-year female came for routine annual health checkup. There were difficulties sampling. We all face this type of situation. And in 2 ml EDTA tube, 1 ml blood was collected. All these parameters are looking normal. MCV is little low, normal hemoglobin, low MCV, and almost normal RBC count. RDW is also almost normal, slightly increased. Clinician thought that they are dealing with some hemoglobinopathy trait. When HPLC was advised, it was normal. Repeat CBC was done, that was also normal. Now, what is the reason of this low MCV? Now look at this relation between hemoglobin and hematocrit. All of us know there is relation of 1:3 with normal hemoglobin. Your analyzers, they are estimating hemoglobin and they are calculating hematocrit. Hematocrit is a calculated parameter. What happens if in a 2 ml tube you are collecting 1 ml blood? Because of excess EDTA, there is shrinkage of red cells. And because of that shrinkage, you will get low MCV. When repeat sample, and this ratio is not maintained 1:3. Repeat sample was collected properly, everything was normal. This is pre-analytical error. We have to collect our sample very carefully because our report is only as good as the quality of sample received. Now, another case. Hemoglobin 8.7, TLC 2800, platelet count 78,000. This patient also came for routine checkup. Pancytopenia. And what is the next investigation in pancytopenia? Bone marrow aspiration. Bone marrow aspiration was planned in this case, but, or you can say advised in the report in this case. But before releasing result, clinician noticed a clot. Again, This is very important. Collect sample properly. When you are receiving in the lab, receive sample properly. I think this was discussed in the pre-examination also. In your clause 7.2 in pre-examination, I think this is 7.2.6, how you are accepting samples. This shall be checked, and before releasing result, in case of these type of abnormality, check sample again. Now, in this case, hemoglobin high, 21.3, TLC high, 22,800. Clinician thought they are dealing with some case of myeloproliferative disorder. Maybe polycythemia vera or something else. But when sample was examined, it was highly lipemic. Lipemia can cause pseudoleukocytosis and pseudo increase in the hemoglobin. And when repeat sample was collected properly, after 3-4 days, everything was normal. Now, this case, again, this is a case of pancytopenia. But what was the problem here? They collected sample from the same arm where the patient was receiving fluids. So it was, these low values were because of dilution. When repeat sample was collected from the other arm, everything was normal. So you can understand how important this pre-examination is. Now, this case, hemoglobin 6.6, MCV 88, and this nutrition anemia was ruled out because of low MCV. But remember one thing, your analyzers, they are measuring only the average value of MCV. When peripheral smear was examined, it was a case of dual deficiency, iron deficiency as well as B12 or folate deficiency. And when hematinics were given, the patient responded very well. See, 70% clinical decisions are based on our report, which shall be error-free, which shall be meaningful for clinician, so that they can make correct diagnosis, correct treatment can be given to the patient, and ultimately patient is receiving better care and we are contributing in that better care. Sometimes we use these terms, quality assurance. What is the meaning of this? Quality assurance means we are assuring someone else. What we are assuring? Quality requirements will be fulfilled. We are assuring someone else. To assure what is required, we shall have good quality control, which is including pre-examination as well as post-examination also. Not only that we are running IQC or we are participating in a class, because 80 to 85% errors are occurring in the pre-examination phase. For this, we need a very good quality management system. How we are managing well-documented quality management system is very important, and this quality management shall be based on some international reference. And what is the reference with us? This ISO 15189, which is being followed all across the globe in more than 80 countries. See, when we talk about quality management system in clinical laboratory, we talk about personnel. Can anybody tell me what is the clause related to personnel? Please write in the chat box. 7.2. Right? These are the various requirements of personnel. People shall be well qualified, trained, competent to carry out various activities, and they shall regularly attend CME seminar or training programs to update their knowledge so that they can serve useful purpose in the laboratory. They shall be provided with adequate and appropriate personal protective equipment based on their responsibilities in the laboratory. Now see, what is this? Sometimes we talk about policy. When we teach ISO 15189, we talk about policy. We talk about program. We talk about procedure, record, document. What are these? Policy is intent. Now, in simple terms, although we discuss all these things during our training program, in simple terms, when we say policy, I am explaining this with your day-to-day life activities. Suppose it is a policy decision. Everyone will get tea around 11. Everyone will get morning tea, evening tea, and lunch during the working hours. This is a policy decision by the management. Intent of the management, everyone should be provided these beverages and food while on duty. Now, to implement this, you are developing a program. What is the program? In the morning time, we will provide either tea or coffee. With that, some snacks. During lunchtime, we will provide some rice, some chapati, dal, sabji, raita, something like that. This is program. And during tea break, we will again provide tea with some biscuits. When we talk about process, when we talk about program, these are unrelated activities. These, whatever you are providing, these snacks and tea, these are unrelated. But you are providing together, then they have some meaning. Similarly, you develop program for your equipments. Daily we will check these things. Weekly we will check these things. That is your program. Those are unrelated activity. You are saying RBC chamber we will clean every week. This plate we will clean every day. So that way you are making program, but those are not related with each other, but they are meaningful. Equipment maintenance is meaningful when you are carrying out all these things in a structured way. Process means sequence of activity. Like in your laboratory, you are receiving requests, you are collecting sample, you are transporting sample, you are receiving sample in the laboratory. Then you are, suppose you need to prepare liquids, you are preparing those, you are sending to laboratory, they are performing tests, they are interpreting the results, then they are developing the report. If some critical result is there, that is being informed to the clinician, and then clinician is taking decision accordingly. This is process, flow of activity. It follows some sequence. So this is process. Now, what is procedure? How you will carry out a particular activity. Like how you will collect the sample. You need procedure for that. How you will transport sample. You need procedure for that. Sometimes you need to develop some process within the process also to carry out something more effectively. Because we are discussing this for the first time, when you will think over it, when you will read some references, you will get more clarity. The procedure is how you will carry out a particular activity linked with a process. Process is sequence of activity. So that way you are developing procedure for each. What is record? Record is evidence of implementation of some activity. You develop IQC record, you develop a class record, you develop attendance record. All these are records. What is document? Any meaningful information on any suitable medium, whether electronic or paper, is called record. Any meaningful information on any suitable medium, whether paper or electronic media, is called document. Evidence of implementation is called record. But that evidence of implementation is also useful information. So all records are documents also, but certain documents you create, certain processes you develop in your lab, certain procedures you develop, those are not evidence of implementation. Those are how you will carry out a particular activity. So all documents are not records, but all records are documents. How you're collecting specimen, how you're labeling sample, how you're mixing sample, how you're transporting sample, how you're receiving samples in the laboratory, what all you are checking. You shall have proper documentation related to this so that everyone is following the same system. This is requirement of your standard also, of your clause related to pre-examination process, that is your 7.2. Whatever we are discussing requirement of the ISO 15189 only. This I am telling you from the practical perspective. Reagents, how you are receiving, how you are storing, how you are carrying out lab acceptance testing. What is the clause related to your reagents? Anyone? Please write in the chat box. Yes, very good. 6.6. Now there's certain terms. Diagnostic sensitivity, diagnostic specificity, positive predictive value, negative predictive value, utility of a test. See, diagnostic sensitivity means out of 100 cases of a particular disease, in how many cases a test is coming positive. If suppose sputum for AFB is positive in 90 cases of pulmonary tuberculosis, open cases of tuberculosis, that means diagnostic sensitivity of sputum for AFB is 90%. Diagnostic specificity means in how many cases who do not have a particular disease, a test is coming negative. If suppose in normal cases, in 5 cases, sputum for AFB is coming positive. So that means diagnostic specificity is 95%. In 95% cases, it is coming negative who do not have disease. So that is 95%. Positive predictive value is if a test is positive, what is the possibility of having that disease? And negative predictive value means if a test is negative, what is the possibility of not having that disease? And you must have seen during COVID-19 time, we used to say positive predictive value of this rapid antigen is high, but negative predictive value is not so high. If this rapid antigen is coming positive, you can say a patient is suffering from COVID-19. But if test is negative, you cannot rule out the possibility of COVID-19. You have to go for RT-PCR. Test utility is decided by these things. Then cost per test, how much time is required to carry out a particular test, what is the complexity, what type of equipment is required, whether our people will be able to understand that complex mechanism or not, and how much time it is taking. Because you again must have seen during COVID time, people used to say, oh, this RT-PCR, it is gold standard, but it is, you are taking too much time. We are getting a report either next day or sometime after 2 days or 3 days. Can you develop some system? We are getting early reports. So then people thought about this CBNet or TrueNet. In this, we will get early reports. So all these things are important when you are deciding about a test to include in your laboratory manual. We talk about if suppose you are buying a new equipment, you want to compare result with the old equipment. Suppose you are buying a hematology graduate with already existing machine, your hemoglobin are 5, 10, 15, 20. What is your expectation with the new machine? Result should come almost similar to your old machine. If it is the ideal situation, you will get a line at 45 degrees. But if your new machine is providing you high results consistently at all ranges, it is called systematic constant error. If low values, again, if the difference is same, systematic constant error. But if this difference is increasing with increasing concentration, it is called systematic proportional error. And if at some point value is high, at some point it is low, then these are called random errors. So when you are comparing new machine with already existing machine, the results should come similar. Otherwise, ask company people why it is happening, and you have confidence on your old machine. Your control results are okay, QoS performance is okay, everything is okay. So why new machine is behaving in a different way? Because you cannot say, if a patient is coming, you are receiving a sample for TLC in the morning, and suppose it is 22,800. In the evening, it is coming 16,400, just because of instrument variation. That is not acceptable. We have to check all these things. When you're buying equipment, what was the clause related to equipments in resources? What was the clause? 6.4. Please write in the chat box. Yes, 6.4. 6.5 is related to calibration, and 6.6 is related to reagents. 6.7 service agreement, and 6.8 your external products and services. When you're buying a new equipment, you have to see all these things. Whether you have sufficient space to keep that machine or not, whether you want to order a floor model or desktop model, how much technical training is required, whether your people will be able to understand all those things or not. Clarity and usefulness of instruction manual, linearity. What is the linearity? What is the maximum value you can report without dilution? And what is the maximum value you are reporting in your lab, even with dilution, is called reportable interval. Precision. If you are testing for multiple times, same sample, results should come close to each other. Carryover. A low value sample shall not be affected by previously run high value sample. Then comparability with an established method, and performance in your IQC and QoS. Analytical sensitivity. What is analytical sensitivity? This machine is measuring that analyte only, nothing else. You must have seen in hematology analyzers, in your 3-part differential, nucleated RBCs are counted as WBCs. Those are not, no, that is analytical specificity. Those are not specific for that particular analyte. This is analytical specificity. And analytical sensitivity is, you can suppose you have 3 machines for hemoglobin. One machine is providing you hemoglobin 12, 13, 14, 15, 16, like that. Difference of 1. Second machine 12.1, 12.2, 12.3, difference of 0.1. Third machine 12.01, 12.02, 12.03. In case of first machine, sensitivity is 1. In case of second machine, it is 0.1. In case of third machine, it is 0.01. You have to see what is the most appropriate for you. Definitely, this 12, 13, 14, if machine is estimating a difference of 1, that is not acceptable. 0.1 is okay. So this is analytical sensitivity. Some books write this analytical sensitivity as what is the minimum value your machine is able to detect. But if you read latest edition of Henry, Todd and Stanford, this book has mentioned for that lowest value of quantification. Now we call that as LLQ, lowest value of quantification. If what is the minimum difference your machine is able to appreciate, that is called analytical sensitivity. Analytical time, how much time a machine is taking to give you one result. Throughput time, it is not the exact multiple of analytical time. If suppose machine is taking 1 minute to give you one result, that doesn't mean in 60 minutes you will get 60 results. In between, machine may require some washing cycle, some rest. Maybe analytical time is 1 minute, but your throughput time may be only, in 60 minutes you are able to run only 30-35 samples. What is the cost per test? When you're deciding about the cost per test, that doesn't mean only reagent cost. Part of your machine cost, part of your reagent cost, IQC, EQUAS, startup procedure, AMC, CMC, all these things contribute to cost per test. Then staff acceptability, how much technical expertise is required to carry out the test. So all these things are important. When you're maintaining instrument, what is the clause related to instrument maintenance? 6.4.5 or 6? 6.4.5. Very good. And what is 6.4.6? Adverse incident and accident. And 6.4.7, equipment record. Good. When we are talking about clauses, people who have attended 15189 2012, I think they must be getting little confused, because in this new standard, all clause numbers, they are changed. So in instrument maintenance, whatever manufacturer is recommending in the daily maintenance, weekly maintenance, monthly maintenance, preventive maintenance by manufacturer, you should develop your program accordingly. You shall have a documented program, how you will maintain your machine. Then certain documentation are important in the laboratory, because these are the areas where we can go wrong in our laboratory, maybe related to equipment, maybe related to our processes or techniques. If environmental conditions are not properly maintained, if personnel's, their competence is not assessed properly, whatever work they are carrying out in your laboratory, their competence shall be demonstrated and documented. What is the clause related to competence, six point 2.1. Good. They have defined qualification in clause 6.2.1 and competence in 6.2.2. That we discussed in yesterday exercise also. Very good. You had all a very good understanding. Post-examination variables, delta check, you are comparing with the previous results. You are comparing with IQC EQUAS result, you are comparing, you are correlating with clinical details. Then you are releasing result, whatever critical result is there, you are informing the clinician immediately. And what is the clause related to critical results? What is the clause related to critical results? What is post-examination? 7.4. After that, reporting of result, 7.4.1. And critical, after that, 0.3, 7.4.1.3. Am I right? Please write in the chat box. Yes, very good. Then specimens shall be checked for clots, as we discussed in one exercise also, if it is a hematology case showing some normality. You shall have a regular interaction with the clinician regarding what are the tests to be performed in the laboratory, what is the information you need on test request form, what is the information they expect from you in test report form, critical alert values, turnaround time, biological reference interval. What is the clause related to biological reference interval? .3 points. Yes, very good. 7.3.5. And what is the clause related to advisory services? It is given in the laboratory activities, 5.3.3. 5.3.1, general information, 5.3.2, conformance with requirement, and 5.3.3, advisory activities. Now the term is advisory activities. Very good. You have to maintain your environmental condition properly. What is the clause related to this? Environmental conditions, facility and environmental conditions, 6.3. You have to participate in internal quality control. You have to monitor carefully. You shall have documented procedure. For quantitative tests, you have to prepare LJ charts. Whenever there is any outlier, take appropriate corrective action on this. Now the standard is not talking about preventive action. They are talking about only corrective action. So instead of kappa analysis, it is CA analysis only. And what is the clause related to your internal quality control? Examination is 7.3. After that, ensuring quality, this validity of examination result, 7.3.7, and IQC 0.2, 7.3.7.2. That is your IQC. You have to carry out some statistical work. These things we will discuss in detail in the coming lecture. All of you have the schedule. These things will be discussed. Every month we will have one lecture. We have designed one lecture, IQC class interpretation, one lecture on statistics also, one lecture on biomedical waste also, different lectures which are useful for your day-to-day laboratory activities. Now you have new standard of this ISO 15189 released in December 22. It has 8 clauses. These, what is the requirement in your lab? You have to develop some management system documentation. You have to develop sample collection manual. You have to develop standard operating procedures, how to carry out some tests. At some places, standard is asking for a procedure, how you will carry out a particular activity related to your maybe release of result or some other activity. So those either you can say documented procedure or you can call those as quality system procedures. And also you have to develop certain processes, flow of activity. What is the process of equipment, selection, purchase, or you can say procurement or management. This is simple examination of a process, flow of activity. If somebody is coming for collection of blood, you're asking that person to sit comfortably, then you're tying the tourniquet, then after cleaning properly, you are collecting blood from the vein, then you're covering pricked area with a cotton swab and you're asking patient to sit for a while, and then you are checking that there is no bleeding from that side, and then you're asking the patient to leave. So this is process of sample collection. That way you have to develop processes wherever standard is asking for this. You shall have sample collection manual at appropriate areas in all sample collection areas and reception. You shall have lab safety manual also. In this, you're documenting all these things: fire safety, chemical safety, needle stick injury, hand hygiene, biomedical waste, spill management, whatever you feel some more things are required, you can add in this. And there is one document also, ISO 15190. You can refer to that document. Standard is talking about few documents. One is ISO 15190, this safety requirements in medical laboratory. One is 22367, risk management in medical laboratory. One is 20658, sample collection techniques in medical laboratory. Wherever study asking for quality system procedure, you have to develop. We will have one session on documentation also. There we will discuss all these things in detail. You have to develop SOPs. This is the requirement of the clause 7.3.6. Certain list. This will help you in the better administration within the laboratory. Use of minor equipment, including calibration, list of approved suppliers. Although this is not the requirement of ISO 15189 in the new edition, but still this is a good practice. But list of referral laboratory is a requirement. List of persons authorized for using computers. In your, what is the clause related to this information management? 7.5 or 7.6? What is the clause related to information management? 7.6. Please write in the chat box. Yes, very good. Then list of stamps which you are using in your laboratory, directory of services, list of staff with their signature for identification, preventive maintenance schedule of major equipments, list of persons authorized to sign final test report. What is the clause related to authorization? 6.2.3 or 4? What is the clause related to authorization? Yes, 6.2.3, not 6.4. 6.4 is related to your post. 6.4 is related to your equipment. Here we are talking about personal, that is 6.2. List of referral laboratory. What is the clause related to this? 6.8 point. What is the clause related to this? 6.8 point 2 or 3? 6.8 point 2. Very good. Last line of 6.8.2 is talking about list of referral laboratory. List of test and measuring equipments. Good. Stock available. What is the clause related to inventory management? Six point inventory management. Yes, very good. 6.6.4. Then you have to create different form and formats. All these shall be prepared by authorized person, then approved by some authorized person, and issued by, again, some authorized person. And also it shall have name and address of the laboratory. See, this quality is a journey without any destination. And never think it is burden on you. When you will start working in your lab with the help of this ISO 15189, and when you will develop good understanding of this ISO 15189, definitely you will enjoy your laboratory work. And this is not difficult. This is possible with the cooperation of everyone working in the laboratory. So thank you for your kind attention. Good luck to all of you for all your future endeavors. This is new standard. Develop very good knowledge in this decade. Probably only this standard will work. You may get new addition after 7-8 years, maybe in 29, maybe in 30, or maybe later. But at present, this document is in your hand, and people who have not participated in the program as per new standard, they also participate as soon as possible. Our next program based on this new standard, online program, is from 3rd to 6th of February. So both options are available, on-site as well as online. So I hope it served some purpose, and NABL will start accepting applications as per new standard from 1st of July. They will keep on accepting application as per old standard till 31st December, and this old edition will remain valid till 31st December 2025. But after 31st of December, application will not be accepted as per old standard. So it is better if you are starting preparation for ISO 15189, start with the new standard. Now, if you have any query, you can write in the chat box. We can take 2-3 questions. Okay. If there is no question, what we will do, or what we should do, we will have a group photograph. So all of you, please switch on your video. So we will have a quick photograph. SP Singh ji, please. SP Singh ji, please switch on your video. I'm clicking photograph. Okay. Yes, right. 1, 2, and 3. One more. All of you, please switch on your video. Dr. Vasudha Singh, Dr. Jogendra Tanwar, Ashish Singh, Victoria, Medha, SP Singh, Onkar Shende, Akriti, Jehar Bharati, Krishna Thapa. Because we have only 2 minutes, then I will click the photograph. Okay. Yes, SP Singh, please unmute yourself.
Yes, sir. Good afternoon, sir. Yeah, good afternoon, sir. Am I audible right now?
Yes, you are audible.
Sir, I just wanted to know that this program is really very good and whatever lecture is there, so can you please provide the recording or study material as a revision?
No, we have recorded this lecture. We will share the link with all of you.
Okay. And the next program will be on the 8th of February on the same time?
I don't know what is the date. 8th of February, same time.
Okay, sir. Okay, thank you.
And the topic is QMS documentation. Right. Thank you. Okay, thank you very much for your participation and looking forward to more interactions with all of you. Thank you.